Welcome to HLSC 4808. This week we will be looking at psychosis. Here is a brief overview of the topics that will be discussed regarding psychosis. We will start with an introduction and some background information. Then we will go into the characteristics and symptoms of psychosis, transitioning into the epidemiology and etiology, then to the treatment approaches that are available. And the portrayal of psychosis in the media will then be discussed. Lastly, a summary of the topics will be discussed. Psychosis is defined as the inability of the mind to differentiate what is real and what is not. Our mind is a complex and evolved filtration system for sensory information. The mind is capable of taking in thousands of information at a time and making sense of it all. Our mind and consciousness is what makes us unique. But what if our mind fails us? How can we differentiate reality from the workings of our imagination? When this occurs, it is called psychosis. Hallucinations and/or delusions are common during psychotic episodes. Psychosis is typically a symptom of another condition or disorder. There is something else typically to cause psychotic symptoms. Psychosis as a word was introduced by Carl Friedrich Kanst in 1841, tracing its Latin translation to giving soul or life to, animating, and quickening. This is fitting of the modern-day classification of psychosis as we know now, giving life or animation to something that is not there.
So now we will be talking about the signs and characteristics of psychosis. Psychosis is specifically related to the impaired relationship with reality. So in terms of characteristics of psychosis, psychosis may appear as a symptom of a number of mental disorders, including mood and personality disorders, schizophrenia, delusional disorder, and substance abuse. Those who are experiencing psychosis can experience cognitive symptoms and behavioral symptoms. In terms of cognitive symptoms, individuals may have hallucinations, which are sensory experiences that occur in the absence of an outside stimuli. So this can be hearing, seeing, feeling, or smelling something that isn't present. For example, a person can have an auditory hallucination where they may hear someone yelling at them, even if that person is not around. Or someone can have visual hallucinations and may see something like a person in front of them who actually isn't there. Individuals may also experience delusions, which is having thoughts that are contrary to actual evidence. So these thoughts are firmly held, even though it's contradicted by reality and what is commonly considered as true. So there's three different types of delusions. There's delusions of paranoia, so these individuals might think that they're being followed when they are not, or that a secret message is being sent to them. Then there's grandiose delusions. So they have an exaggerated sense of importance, so that they are famous, they can end world wars, or that they are immortal. And then lastly, there are somatic delusions. So this is when a person believes that they have a terminal illness, but in reality they are healthy. In terms of behavioral symptoms, they may experience aggressive behaviors. So these hallucinations and delusions may cause them to be aggressive or be caused by an environmental frustrating event for them. In addition, individuals who experience psychosis can be disorganized or have abnormal behaviors. One of these can be catatonic behavior, which is they can either have a complete or lack of inappropriate excess of motor activity. So they can be completely rigid and unable to move, or they can be in constant motion. In terms of disorganized behavior, this is unpredictable and inappropriate for a situation. So for example, these individuals can be screaming obscenities in the middle of a class. In terms of disorganized or non-sensual speech, these individuals, when they experience hallucinations and delusions, they can make their thoughts and emotions feel confused and disorganized. So people who experience this may have racing thoughts and flight ideas at the same time. So for example, they may find it difficult to keep their attention on one thing. They also may change the topic of conversation very quickly as their thoughts move from one thing to another. And they may even speak very quickly and stumble over the words, so others may find it difficult to understand what is being said. Then there's also social withdrawal, which is something they can experience. So, in terms of social withdrawal, they may be unable to identify a need to initiate or maintain friendships due to negative symptoms or maladaptive cognitions about the social world. So, they may be too distressed to meaningfully participate in social interventions due to active symptoms.
So we're going to start off with the etiology of psychosis. So the incidence varies among sex, age, ethnicity, setting, and relationship with others. The main causes of psychosis is not always known, but there are some known risk factors that contribute to the etiology. And these are drugs, genetics, trauma, injury / illnesses, and each psychosis is different, and the precise cause is not always clear. Certain illnesses can be the cause of psychosis, and there are also triggers such as the use of drugs, lack of sleep, and environmental factors. And in addition to these, certain situations can also lead to specific types of psychosis developing into further progression of a diagnosis. So now we're going to get into defining psychosis and going into the defining psychosis in terms of the etiology of it. And etiological factors related to psychosis include psychotic disorders such as schizophrenia, which is undifferentiated, paranoia, paranoid, disorganized, residual, and other things like brief psychotic disorder and mood-induced psychosis, many of which you may know about major depression, maniac, or mixed episodes. Things like substance-induced psychosis, which is due to an illicit or prescribed medication. And the etiological side of it is mainly due to psychotic disorders, which is medical conditions such as Huntington's chorea, epilepsy, migraines, hyper or hypothyroidism, hypoxia, hypoglycemia, fluid and electrolyte imbalances, hepatic or renal disease, autoimmune diseases, and things like postpartum and intensive care unit ICU. So the list goes on, and the etiological fact of psychosis, which is mainly due to a medical condition, could be due to a medical condition, and many of which the related factors of psychosis is the disorder side of things, and knowing what those different factors are related in terms of disorders and psychotic disorders. Moving along to the etiology of psychosis, some psychotic episodes actually require long-term or lifelong pharmacological and somatic therapies, whereas others may actually resolve after medical disorders are treated. But regardless, sometimes frightening nature and debilitating effects of symptoms, such as delusions or hallucinations, can actually be managed. So many of these pharmacological or somatic therapies can actually help individuals that have delusions or hallucinations. Psychotic disorders can actually be managed for a long-term time period. So in terms of pharmacological care, these are things like psychotropics, which are sometimes prescribed, such as antipsychotics and mood stabilizers and antidepressants, which are mainly prescribed for depression. Therapies that include long-term psychotic episodes that are long-term or lifelong include behavioral therapies, which may include the individual, family, group, and as well as patient family support groups. So these are things that lifelong / long-term pharmacological or somatic therapies can help individuals in terms of the etiological factors that are related to psychotic disorders. So now we're going to be moving along to the epidemiology side of psychosis. So the epidemiology of the first episode of Psychosis is actually not really properly understood in terms of research because of the lack of studies grasping a full understanding of the disorder. And the epidemiology of psychosis is also the base information in terms of understanding the disorder and foundation on which is clinical, biological, therapeutic, and the long-term studies that are also built upon that. So here we have a list of incidences, distribution, and possible control of diseases and other factors that relate to the epidemiology side of psychosis. So here we have the environmental side, which are things like ICU. We have the personal side, which is substance-induced psychosis. We have the developmental side, which can also occur during postpartum. And lastly, we also have the genetic side of things, familial side, which includes bipolar disease and schizophrenia, which is known that it can be passed down through the genetic of the individual with the certain disorder of psychosis. Compared to the general population, homeless people actually suffer from a greater prevalence of psychiatric disorders, including schizophrenia and other psychotic disorders. The reported magnitude of mental disorders among homeless people range from about 25 to 50% across all research studies, and the prevalent rate rises to about 92% among those who are street homeless. And the presence of mental disorders among homeless people is linked with a higher risk of disability and mortality rates from suicide and general medical conditions, as well as alcohol and drug-related causes. The epidemiological evidence from several studies have shown that psychotic disorders are among the most common psychotic disorders among homeless people. As you can imagine, they are associated with a greater risk of comorbid physical disease, substance use, and disability, as well as mortality from different causes. The reported prevalence estimates of psychotic disorders among homeless people range from 2.29 to 60%, which is a lot, depending on the research study that is done. The impacts of psychotic disorders among homeless people could be severe, extensive, and it's negative, impacting the homeless subpopulation, individuals that are suffering from it, families, relatives, and other populations. The mechanisms that fall under the epidemiological side of psychosis is mainly the neurobiological change in the individual's brain and affects their thinking and their behaviors, and the related pathophysiological concepts in terms of psychosis include delirium, dementia, amnestic disorders, and various other things. Identifying these concepts and differential diagnosis can help to decide what these mechanisms are related to in terms of the epidemiological side of psychosis.
Now we're going to move on to discussing specific treatments for psychosis. So as with all treatments, there is medical treatments and non-medical treatments. So we're first going to talk about the medical treatments for psychosis. So this is really more so about antipsychotic medications when you're talking about medical treatments for psychosis. So antipsychotic medications are considered to be the most popular and the most common medical treatment when it comes to treating psychosis and even schizophrenia. It has resulted in some patients even stating that this kind of medication has led to lessening symptoms such as decreased hallucinations and delusions. However, as with everything, it has its side effects, and these side effects can be very severe and detrimental depending upon the individual's response to it. So this could be decreased emotional expressions and even substantial weight gains. And it may even lead to exacerbating positive symptoms like more intensified and stronger hallucinations or delusions. When it comes to antipsychotic medications, there is usually a very specific procedure used when prescribing this kind of medication. It's done through two phases. So the first phase is the acute phase, in which patients are given fast-acting medications to lessen and counteract immediate symptoms. And in this case, immediate symptoms would be those hallucinations and delusions. What is also really good about this phase is that they're given fast-acting medications so that the patient doesn't become a danger to themselves and doesn't become a danger to others. The second phase is the maintenance phase, which is dosage is lessened at a very gradual and steady pace, and the community plays a bigger role in this phase where it consists of mostly family and friends, a lot of interventions involving the patient's family and friends. Now moving on to non-medical treatments that are available for psychosis. So firstly, we're going to start with cognitive behavioral therapy, or otherwise known as CBT. So this focuses on the thoughts, emotions, and behaviors of the patient, and even how their thoughts and behaviors influence their emotions. So really the emphasis is on people identifying those unhelpful thinking techniques and recognizing them, and changing the perceptions that person has. What's really good about this therapy as well is that it has become an even more recommended treatment option over antipsychotic medications. The next non-medical treatment option for psychosis is cognitive remediation, which focuses on the cognitive difficulties presented by people with psychosis. So these cognitive difficulties could be things like they have a trouble planning, they have trouble paying attention for a certain amount of time, they have trouble remembering certain things. And this type of treatment really focuses on those aspects, and it has even led to improved cognitive functioning with, of course, memory, planning, and attention. Additionally, also within non-medical treatments for psychosis is psychosocial therapies, which consists of things like skills training, which is just individuals practicing certain skills they may have trouble with or practicing skills that they will need to use on a day-to-day basis. Assertive community treatments is more community-based. An example of this would be teens from a local high school visiting patients in the hospital. And family therapy. Family therapy is a group therapy session with the patient's family where everyone talks about their challenges, and it gives really the patient's family a really good opportunity to understand what the patient is going through. Moving on to newer treatments, evidence that is from recent years, is a newer treatment called commuter-mediated therapy, and it's a newer treatment option in which there has been a lot of recent evidence within the past 2 years. So the basic story of this newer treatment is MRI scans show that video games can be played with or modified to turn on specific areas of the brain. So this results from this treatment have shown that there's been improved cognitive functioning. It leads to increased gray matter in the brain, which then leads to better overall functioning. So it can be an interesting as well as enjoyable way to treat psychosis. So obviously this therapy is focusing again on those cognitive functions, improving those cognitive functions, because we know people that are diagnosed with psychosis, they do have a lot of cognitive difficulties. And what also is really good about newer treatments such as computer-mediated therapy is that it shows that we are evolving in the medical field. We're finding different and new ways to treat people instead of using the same old traditional therapies or treatment options that we've used for decades.
Stigma of mental health has always been present and an issue within our society. Stigma can be described as a negative perspective towards someone based on a quality or a characteristic that they have. Individuals who are battling mental illnesses are labeled by their disorder rather than the person, which creates the stigma. This is often translated into discrimination, and those affected are often treated differently based on their mental health. An example of this is seen in the workplace. A company that often interacts with consumers face to face might label a potential employee seeking employment as someone who may not be able to provide good customer service solely based on if they have a mental illness such as anxiety. Stigma of mental health is always. So when we look at the stigma within media, it's crucial to talk about social media platforms, especially as they're heavily used within our society. And although there are various benefits to these platforms, such as Facebook, Instagram, and Twitter, and also the advancement in technology as a whole and how far we've come, it acts as a double edged sword when discussing mental health. So, with technology and social media at our disposal, it gives the opportunity for people to misuse these platforms and to use them for things like bullying. It's easier than ever to say something to someone behind a screen, no matter where you are or if you know them personally. However, we need to ensure the right things are being said because we are not totally aware of what that person may be going through. The media itself also inaccurately portrays what mental health is, which is then viewed at and followed by society. The effect that the media and news has on us individuals within the population plays a big part in how we interact with each other. The benefit that technology brings us is that we can use these platforms to help combat stigma together by spreading awareness and taking part in campaigns such as Bell Let's Talk. So when we look at how the media views psychosis, we know that psychosis is a thought disorder where individuals cannot distinguish what is real and what is not. So most often the media portrays this disorder along with other mental illnesses in general in a negative manner or something that it is not. So 1% of the world's population is diagnosed with psychosis, and compared to how many people actually struggle with episodes of psychosis, individuals who don't may label someone who experiences episodes or violent or out of the norm behavior as crazy or psychotic. And this mainly comes from the picture the media creates for the population to see. So, a way that the media creates the illustration on what psychosis looks like is within the film industry. In most often cases in films where characters display unbalanced or violent behavior, this creates a picture for the viewers that the characters are crazy or psychotic. The story that most films create for entertainment with these characteristics on their main characters allow individuals to label someone's behavior in the real world and to label them as well based on what the media gives them within their films. Psychosis specifically is viewed as a split personality disorder, even though it is not a true assessment, but instead a form of it. Some films where this shows include Me, Myself, and Irene and American Psycho, where psychosis is negatively portrayed as the main characters are labeled with this disorder while displaying violent and deranged behavior.
Psychosis was once misunderstood and there was a lack of concrete scientific evidence. Now we are more educated than ever on the etiology, symptomology, and treatments for psychosis. It is prevalent in our society today and can affect someone unexpected or an individual that may seem otherwise mentally healthy. We are all continually improving our treatments and awareness. We should all continue to take our part to educate ourselves and others who might be experiencing psychotic symptoms. Thank you very much. And just finally for some food for thought here, do you think that individuals experiencing psychotic symptoms can get better? Why do you think people may have these psychotic episodes?